We will get started. Just some housekeeping here in the beginning. We will be recording this meeting, and that recording will be used as a part of the training for those that aren't able to attend but want to watch it and still work for CME credit. So you will receive an email with all the information you need after this meeting. So welcome. I'm excited to get started. If you have questions throughout the presentation, another housekeeping note would be to just drop those questions into the chat. I won't be able to see those while I'm giving the presentation, but we'll certainly circle back to the chat and then answer those questions. So feel free to chat questions at any time in the presentation, and I will circle back to that. So this is a recorded presentation, as I mentioned. The chat function is available for questions to be answered at the end. I am going to go ahead and turn off my own video just to help with bandwidth and when playing all the videos in this presentation, and then I'll turn that back on at the end. So again, thank you so much for joining us for this presentation on Count the Kicks, and in partnership with the Department of Health, the Florida Department of Health. A huge thank you to them for all that they do to save babies with us and to support the work that you're doing. I do want to mention that this is a presentation available for CME credit. Participation in this 1-hour live training equals 1 CME credit. Post-webinar, an evaluation link will be sent to attendees via email. Completion will be required to receive the certificate. So it's really important that you respond to that email. It will be clearly stated how you can earn those credits. Credit is given through the Clinical Directors Network, and I, as a CME presenter, have no disclosures regarding financial relationships or unlabeled investigational uses of products. So who am I? I am Jen Rowry. I am the Associate Director of Engagement for Healthy Birthday, Inc., AKA Count the Kicks. Healthy Birthday is the nonprofit organization that runs the public health campaign Count the Kicks. I have been with the organization since February of 2018, formally as an employee, but supported the organization long before that, as I am next door neighbors with one of the founding moms, and have just really become passionate about the work that we do. And now as an employee, I love sharing the mission of Count the Kicks. I love the impact that it's having. And I love the partnerships that we're able to build that are bridging the gaps that we need to get babies here safely. My background is in education. And because this is an educational campaign that empowers women, I am all about that. I believe that education is power. And my education background makes me even more excited to share the message that we have to share. What does an Associate Director of Engagement do? I engage partnerships, I give presentations, I engage volunteers, and specifically work with our high-level trained volunteers called ambassadors. And we'll talk more about ambassadors later in this presentation, but it's a real passion of mine to support those women across this country, one in your state, and to just support the work they're doing, that grassroots, boots on the ground, passionate work. And so let's get started. I would love to start today with a feel-good story that gives you a good overview of Count the Kicks. It highlights our free Count the Kicks app, and it highlights the power of mom-to-mom storytelling and how that can impact the actions of others. It also shows the power of mom being educated on movement and voicing those concerns to her provider. And so you will hear from Emily Ecoff, the mother of baby Ruby, in this story. I especially want you to pay attention to some of the things she describes surrounding movement, because we'll talk more about that. So it highlights lots of things for us today. I hope you enjoy it.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
We're going to turn now.
So yeah, that is a great testimony to what we're here to talk about today. So Count the Kicks is a highly effective evidence-based stillbirth prevention campaign. We have developed an early warning system for moms, and we are saving 1 in 3 at-risk babies in Iowa, and we will talk more about that. Our campaign is ready to go, and it is low cost, and thanks to our great partnership with the Florida Department of Health, it is no cost to you. So before we get too far, I think it's really important that we highlight what we're talking about. We're talking about stillbirth. What is that? A stillbirth is a loss of a baby after 20 weeks of pregnancy. And we can further define that between early, late, and term stillbirths. As we talk more about Count the Kicks and when we advise moms to start tracking movement, we are talking about 26 weeks for high-risk moms, 28 weeks for a normal pregnancy. That 3rd trimester of pregnancy is really where Count the Kicks is educating, empowering moms, and informing the work we're doing. And so we're really focused in on those late and term stillbirth prevention measures, and we do know that stillbirth is preventable. I want to highlight that we lose on average 23,500 babies every year to stillbirth in this country. Again, 23,500 babies every year to stillbirth. We need to be talking about that. Infant mortality, we also lose way too many babies. We lose around 22,000 babies to infant mortality a year, but we're losing slightly more to stillbirth. So we need to have the conversation about stillbirth. We need to be talking about both of these important topics and doing what we can to prevent them. Why are we losing babies to stillbirth? There are a list of reasons, and some of them are quite frankly unknown. Not every stillbirth has a defined cause, but some of those things could be pregnancy and labor complications, problems with the placenta, birth defects, infections, like a pandemic, problems with the umbilical cord, medical complications in the mother. And I'm not going to spend a lot of time defining that. We could definitely talk about why these are, causes of stillbirth. But really, if you want to learn more about this, there's a study here at the bottom. If you're a person that really likes data, really likes to read studies, we are always highlighting those studies. We have them not only on these slides that will be shared with you, but we have them on our website. And so you can always find the information that's informing our work as well. Stillbirth is a significant issue, as highlighted by the numbers I just shared, but it is rarely talked about. If we don't talk about it, if we don't learn about it, if we don't do something about it, it will not change. And that's why we're here today, is to talk about how we can change these numbers. Because sadly in this country, 1 in 169 pregnancies ends in stillbirth. Racial disparities are huge. A Black woman, depending on the state, is 2 to 3 times more likely to lose her baby to stillbirth than her white neighbor, friend, or counterpart. That is simply unacceptable. So a Black woman in this country has a 1 in 96 risk of losing her baby to stillbirth. Hispanic mamas also suffer high risk. In 1 in 199 pregnancies, there is loss. Indigenous or Native American moms, again, very high risk, 1 in 138. White moms, 1 in 204 pregnancies end in stillbirth. And for Asian Pacific Islanders, that number's 1 in 233. So stillbirth is just as prevalent, a little bit more prevalent than infant mortality. We need to talk about it. Families are actually 10 times more likely to lose a baby to stillbirth than SIDS. Let me say that again. 10 times more likely to lose a baby to stillbirth than SIDS. We want to be like the Back to Sleep campaign, where every woman knows to count her kicks, just like she knows to lay her baby on its back to sleep. In the US, we lose 65 babies or a busload of children per day to stillbirth. This is simply unacceptable and needs to be addressed. Talking about stillbirth data, let's talk about Florida's data. The 2019 rate for Florida is 6.8 in 1,000 deliveries. That is higher than the national average currently. That means 1,515 babies didn't come home in 2019. And we want to influence that number in the right way. The percentage for a white woman is 5.2, Hispanic 5.7, Black, look at that number, 11.5. So the numbers in the state of Florida follow the trends. It's actually a little bit lower for Hispanic moms than that number we just shared as far as the rate of doubling. But for Black women, it's extremely high. Non-Hispanic Black women, again, very high risk, 11.0. And so all of this is data from the Florida Department of Health. So let's talk about Iowa and our stillbirth rate. And so this, as I mentioned, if you weren't on at the very beginning, we are based in Iowa. This is an organization that was founded by 5 women who lost babies in the early 2000s to stillbirth. They ask a lot of hard questions that did not have great answers. And one reason they didn't have answers is we in the state of Iowa and across this nation at that time were not collecting data on stillbirths, why they were happening, where they were happening, when they were happening. And so the first action that this group of women took was to create a national stillbirth registry. But then they were at a conference in Washington, DC, learning more about stillbirth. They were actually presenting on the registry and listened to a very important study out of Norway. And we'll talk about that study. That is when Count the Kicks was born, the 2007-2008 timeframe. And you can see these blue dots. The blue dots are Iowa. The red line is the national average. And then the dotted line is the trend line. And in the state of Iowa, since the launch of Count the Kicks, which would have been here, where this blue dot was, we have had a steady decrease in the number of stillbirths. Our trend line is down. In fact, we're saving 1 in 3 at-risk babies in our state. Yes, there are outlier dots, as you can see here. Things like pandemics, syphilis outbreak, and a low birth rate state can really influence the number. So we try to look at trends in the 3 to 5 year averages and not specifically just year to year. But we want to see this trend line happen in Florida, and we think we have a solution to bring to you that might help with that. Going back to racial disparities, why are there such large racial disparities in stillbirth? Research shows that there are lots of contributing factors, and I just like to highlight a few of those for you. Systemic racism in our system is definitely a factor. I think it's something that we all realize as a society. And in the last couple of years, we've really done a better job of having these discussions and highlighting these things, but that can't stop. Toxic stress, how that impacts a woman's health. An African-American woman under that type of stress is likely to have real and pervasive health issues, and we see that. Epigenetics, your genes play an important role in your health, but so do your behaviors and your environment, such as what you eat and how physically active you are. Epigenetics simply is the study of how your behaviors and environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence, thus impacting your health. And so this goes back to the toxic stress, the systemic racism that causes that toxic stress. We know that these women, and likely because of the things we're talking about, but genetically, they are prone to certain health conditions, or more prone, such as preeclampsia, gestational diabetes, or high blood pressure. We know that access to healthcare and that barrier to healthcare, we know that studies are showing that Black women are not receiving that first trimester of pregnancy healthcare, that they're actually accessing the system later in their pregnancy. Socioeconomic barriers, poverty does increase your risk of stillbirth. And we do know as well that research shows, early there, research shows that education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So education is not a determining factor in your risk for stillbirth. What is Count the Kicks doing to reduce disparities in stillbirth? Well, we have an amazing health equity coordinator, Stephanie Moody, on staff that's helping us target our own organization and our own practices and the work that we're doing outside of the organization, and the outreach that we need to have and the way that we need to have that outreach. So we're always looking for funding opportunities to reduce racial disparities. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. Those conversations are ongoing. We've literally looked at everything from our own hiring practices to our communications and beyond to make sure that we're doing the best we can internally so that we can do the best we can externally. We are improving programming based on the lived experiences of women of color, whether it's holding focus groups, working with Stephanie, working with other organizations. We are trying to reach those marginalized communities. We're trying to expand our app. It is currently in 12 languages, just trying to reduce any barriers. We have culturally appropriate educational materials, and we have videos printed, educational materials and FAQs in multiple languages, again, trying to remove as many barriers to access our program as possible. So I said I'd reference the research study that gave that trend line in the state of Iowa, and that is exactly what this slide is highlighting. So our founders found, listened to a presentation on this study that was done in Norway that actually led to a 30% reduction in that country's stillbirth rate. And how did they do that? They educated their practitioners and expectant women on the importance of monitoring movement and speaking up to your provider if you notice a change. And they implemented this countrywide, systems-wide, and targeted the two audiences, providers and expected women, and made sure that they had the education they needed. And they saw that 30% reduction. Dr. Ruth Fretz from the Harvard Medical School and a part of ACOG was a part of that study. Dr. Fretz currently sits and has sat on our medical advisory board and is a strong believer in the work that we're doing. And her quote is pretty powerful here. It says, "Tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change." This study is highlighted here on the slide, but also again, you can go to our website if you want to read the full study. And this is one research study that triggered the Count the Kicks campaign, but we have many other research studies. We're constantly following the most current stillbirth research. In fact, we have been named by the Association of Maternal Child Health or Programs, or AmChimp, as a best practice based on their own scientific review. We have been named this best practice because of the work that we're doing. And so we are super excited to work with AmChimp and the organizations like state health departments and such across the nation to reduce this horrible stillbirth number. The CDC is talking about movement. As a part of her Hear Her campaign, they list 15 important or urgent warning signs for pregnant women to know. And we're just highlighting here that they're talking about engaging women to track their baby's movement and to speak up if they notice a change in that movement. One thing that we hear sometimes is that people don't want to talk, providers or healthcare workers don't want to talk to expectant women about kick counting because they don't want to increase their anxiety level. They don't want to unnecessarily scare women. And so one thing we have done, we've studied our own app users. There are other research studies out there on this. And it basically has debunked that. One potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. This was based on a research study done by Des Moines University and the Harkin Institute. Reflecting on our own app users and the surveys we've done with them, 84% have stated that regular tracking was associated with feelings of bonding, and 77% of our app users actually reported feeling less anxious. Education is empowering, and it actually gives them the tools they need to know when they should or should not be worried. So not only were they not more anxious, they were actually less anxious when using our Count the Kicks app. Maternal fetal movement monitoring has additional benefits. It has a reduction of preterm birth rates. We have not in our state of Iowa seen an increase in cesarean section rates. And so we know that it can also catch fetal growth restrictions if they're identified earlier. Women bond with their baby. That was a big part of the research study that came from this. It's actually a time for women to sit, think about their pregnancy, think about their baby, think about their body, and dream with that baby. Get to know that baby's habits and patterns. And we've heard oftentimes that the patterns that these babies have are transient into their birth time. You know, like they come to this earth and maybe they're night owls still, just like mom noticed when she was monitoring their patterns. And so bonding with baby is huge. It may be an indicator that mom herself is experiencing health issues. We recently just received a story where mom actually had a huge spike in blood pressure. And although she wasn't feeling 100%, she didn't associate it with any risk in her pregnancy. What she did notice is a change in her baby's movement, which is what took her to her provider and actually prevented her from potentially having a major health complication herself. One thing we do want to note on this slide, women who have stillbirths are at substantially higher risk for severe maternal morbidity, and that women who have live births, regardless of cause of fetal death. And so we want you to know that it's like a 5 times higher risk if a woman's experienced a stillbirth to actually have her life be at higher risk. And so that's simply not acceptable, and something I think that we can help as well. Additional research articles. Again, I mentioned that if you're really involved in reading the data, doing the research, reading what's out there on stillbirth research, we highly encourage you to be informed and educated as well. And here on this slide are some additional research studies that, again, this will be emailed out to you. And you're welcome to also go to our www.countthekicks.org website to find these studies and many others. So implementation of Count the Kicks. Let's talk about it. Count the Kicks is a stillbirth prevention public health campaign. It is evidence-based and it is mom-focused. Notice these colors, they are bright. They are, this was never meant, one thing that was really important to the founding women was for this not to be a fear-based campaign. Again, going back to not creating unnecessary anxiety. And so the materials are very bright. Our colors are very bright and cheery, and they also are, the education is very mom focused. It is not medically Written, it is meant to be appealing to the mom who's reading it. It does educate women on the importance of tracking fetal movement. We have a free mobile app, and we have downloadable paper kick counting charts on our website. This program simply empowers mom to speak up to providers if there is a concern. Talking about that app, let's go into detail. So the app is free. It does not have ads or advertisements. It is based on research. It is informed on research. And so our free app is available in 12 languages. Those languages are listed. I won't read those for you, but we are super excited about the Haitian Creole. This is something specifically the Florida Department of Health has helped provide, is the app in Haitian Creole and the materials in Haitian Creole. And we think that's vital to know the population that you're serving and how to reach them. And so we're very excited about that addition and thankful for that addition. If there is ever a language that's not on our app and you think that it could really serve the population that you're serving, please make sure you reach out to us or reach out to Casey Omeki at the Florida Department of Health and let us know that. That's something that if we have information, maybe we can find funding or find the opportunity to add that to our app or our materials. Our app is available for Apple and Android products. Users can restart their session or delete a kick. It has daily reminders. We all get busy. That daily reminder is there so that mom doesn't lose track of time and remembers to do her kick counting session, which we encourage moms to do 1 time a day. Find that time of day that's not only convenient for you to do it, but is a time of day that the baby may be most active so that you can capture that data. You can always review your kick counting history, and you can count for twins. You can track future pregnancies. And this can be on your iPad and your iPhone, so it can be managed in multiple devices, registered to your account, and super excited that it is now available on Apple smartwatches. And so that is a new feature that came this summer and I think is super handy to moms. Other things that are important to note, we also this summer added a strength tracking and notes feature to our app. Notice Emily Ecoff's story on Good Morning America. She was baby Ruby's mom. She noted not only did the frequency or duration of movement change, but the strength of baby's movement also changed. She said it became softer, more subtle, not as hard. Research has informed that the strength of baby's movement can also be impacted if baby's in distress. And if you think about yourself, when you are not feeling well, if you have the flu, you conserve energy, right? You go to your couch, you don't go out for your daily jog. And so when you're not feeling well, you slow down. Babies are just like you and I. The other thing to note is when I've had the flu, I feel weak. It's a lot of work to go up a flight of stairs. I might feel weak and shaky and sweaty. When a baby isn't feeling well, they also feel weak, and the strength of their movement can be a sign of distress. How do moms measure these movements? So they're going to have a kick counting session, and we're going to have a little video that shows you more about how that happens. So I won't go into too much detail. And then after that kick counting session, they are going to actually be able to judge how the movement felt. So it's somewhat subjective, where mom's actually paying attention to how that movement feels, not just the number of movements, but the feeling of movement. And she can decide if it felt like 1 footprint, which is fluttery or light, to 5 footprints, which is fierce and strong. And then that is recorded in the chart as well. So there's a bar graph that shows movement, and then we see that chart for the actual duration of movement. And they finish the session. They can take notes in there as well and save those. Maybe they get interrupted during that session and they want to say, I was interrupted 3 times. I think it may have, distracted me, and my session may have taken longer, whatever it is that they want to say. Another new feature, which has just been released this week, is the Count the Kicks app now has video capability to educate users. So the videos that we can share about how to do it. So this is very helpful because it adds another visual component and educational component more than just reading the information. And so we're excited about the capability to offer that to our app users. Let's watch a little video on the app now to just learn how it is used.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So as you can see, it was super easy to use. And it provides a great tool so mom has the data she needs. It's an easy way for her to track that movement, which is so important to saving babies. And so let's have that stillbirth conversation, and you're going to have it as well. So let's talk about that. Talking about Count the Kicks, first of all, if a expectant parent is 26 weeks and high risk, that is when you start the conversation with a high risk patient. 28 weeks otherwise, which is the beginning of that 3rd trimester. And so that is when you start having the conversation. Why? That's because that's when baby's movement is established enough to create that pattern that mom needs to track her movement. And then how do you have the conversation? First of all, you want to make sure that you are having the conversation regularly during the 3rd trimester, and that you've had it before the 3rd trimester, so that moms know they know that it's coming. They've downloaded the app, they're prepared, and they then will have that conversation, hopefully with you every time you're with them in the 3rd trimester. Depending on the work you're doing, you may have to adapt when you have these conversations. If you only have one touch point early on, then it'll be important to have the conversation then. But if you're working with expectant women throughout the course of that 3rd trimester and throughout the course of their pregnancy, it's important to have that conversation as often as you can, and certainly every touch point in that 3rd trimester. Make sure you say, let's talk about how to track your baby's movements. Share with them that movements are jabs, rolls, pushes, anything but hiccups. Hiccups are an involuntary movement. And so the movements they're measuring in that 3rd trimester need to be jabs, rolls, or pushes. And as they progress throughout the pregnancy, the feeling of movement may change, but the baby still will continue to move. How it feels, maybe less of those rolls and more pushes. That is true. That can change. But a healthy baby is going to remain an active baby all the way up through labor. Make sure you share the Count the Kicks app. Just a helpful tip: if you are in a clinical setting waiting for that glucose test that moms take, would be a perfect time to have them download the app and to have this initial conversation. And then, of course, following up when they hit their 26th if they're high risk, or 28th week in a normal pregnancy. So some pushback sometimes comes for having the conversation because you don't want to scare moms. We don't want to scare moms either. And so I think it's important to have, but it's still important to have the conversation. We inform pregnant moms all the time about risks in pregnancy. We do gestational diabetes tests, not because we want to scare them, but because we know that it's important to maintaining health. Just like women have mammograms, we're not trying to scare them about breast cancer, but certainly early detection is saving lives. We want to be just like that in the conversations with stillbirth. It doesn't mean that we're trying to scare them, but we are trying to inform and educate, and education is power. Women are not delicate flowers. They can handle hard conversations. When you're testing for, other issues in pregnancy, you don't skirt away from that because you know that that information can be powerful in having a healthy mom and a healthy baby. And so stillbirth is the same. Stillbirth just happens. There's nothing we can do. That's not true. Stillbirth doesn't just happen. That some stillbirth is not preventable, and we recognize that. But we do know that some stillbirth is preventable. In fact, there are warning signs that moms need to look for, and we want them to know that they should speak up if they have those. We want them to know what the warning signs are, and then we want them to know that they should be able to speak up. We want to save 1 in 3 at-risk babies in Florida, just like we're doing in Iowa. Her baby is always active. It's not a concern. Babies are active until they're not, and some issues can come upon suddenly. And so we want mom to know what her normal is so that she knows when to speak up. If she just notices no movement for a long period of time but doesn't know what to do with that, that can be dangerous. And so all women should be tracking movement. All women should be tracking movement and learning their baby's normal amount of time to get to 10 kicks. And then after they establish that pattern, say it takes 10 minutes to get to 10 kicks on average, if it takes an hour and 10 minutes, they'll know that's a change and they need to speak up to their provider. She's almost at her due date. Actually, the risk of stillbirth increases as a mom approaches or exceeds her due date. And so it's really important that we not have them get comfortable and stop paying attention to movement. Those term stillbirths, there's actually an increase in risk to mom and baby there. You still have to have the conversation if a mom has experienced a loss. And so that's a more delicate conversation. You certainly want to share the same information about kick counting and the importance of it. A mom who's lost a stillbirth, remember, is more at risk of suffering another stillbirth, but also potentially there's more risk to her health. And so she would be considered a high risk pregnancy. So you'll start that conversation at 26 weeks versus 28 weeks. Feel free to talk about this previous stillbirth. I mentioned the ambassador program. I work with a lot of women who have lost babies. Those babies are a part of their days and their lives, and every hour and minute, and they're important parts of their life and their experience. And you need to address that. You need to call that baby by name if you know it. You need to interact with them about their loss and their baby, and be empathetic. Obviously, we know that you are, and we want to just make sure that they feel heard. And then we want to have the conversation, has anyone had a conversation with you about tracking movement? We want to provide them that power. There's a lot of anxiety in that pregnancy after loss. And that is, I think, actually, kick counting is one of the solutions to help ease their anxiety so that they have something that they're doing and data that they have to feel informed, educated, and empowered in their pregnancy. Common myths in pregnancy. I think these are super important. So my baby is always active. I don't need to count the kicks. We just talked about that. That is obviously false. All women need to be counting their kicks, high risk, no risk, and everybody in between, active babies, slow babies, it doesn't matter. So what we know is that every baby and every pregnancy is different, which is why it's important for women to learn their baby's normal movement patterns so that they have that foundation to go off of so that they can recognize that change. Only those experiencing a high-risk pregnancy should pay attention to their baby's movement. Again, that is false. All should learn their normal, as I just mentioned. A baby should get to 10 kicks in 2 hours. This is actually outdated information and is not recommended. There's been studies done on putting time limits on kick counting. And what human beings do is they look at the time more important, and they will look at that time instead of looking at the patterns or the trends and listening to their own instincts, because women do have those maternal instincts and we want them to trust their gut. If they're concerned, better to speak up and find out baby is fine than to not speak up, wait too long, and have to deal with the devastation of loss or seriously ill baby. And so we want them to know those signs. putting a time limit on it is not a safe way to do that, because what if my baby's normal is, getting 10 kicks in 30 minutes, and that's my baby's normal. And today it took 1 hour and 55 minutes. That's a pretty significant change to a baby's normal movement pattern. That could be a real warning sign, because we know movement is an early warning sign, where heartbeat is a late warning sign. So movement is an early warning sign of distress, and we want to catch it as quickly as we can, because we do know that hours and minutes matter when it comes to prevention. And so just encourage you to use the app with your clients and your patients, but to also educate them on learning their baby's normal, and not use time limits to do that. I can use a Doppler device to monitor my baby's well-being. We strongly discourage women from using over-the-counter, so to speak, Doppler devices. First of all, there are different forms of technology, different qualities of technology out there. Second of all, they are not trained. They could easily be hearing their own heartbeat instead of a baby's heartbeat. And finally, as I mentioned before, when the baby's heartbeat is being affected, that's actually a late warning sign of distress. And so we would prefer they focus on the movement as an early warning sign, and not feel reassured by a Doppler device that could be misleading them or being misused. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. Certainly something I believed in my pregnancies, but research is showing that this is actually outdated and should not be what we are educating moms. It's really important to not trick the baby into movement, so to speak, to not create that false sense of security. We need to recognize that if the baby's movement has changed, that could be the sign that it's trying to give us that there's a problem. And we need to acknowledge that. We need to evaluate that. And then we need to determine, the provider needs to determine what comes next, what tests to run, what actions to take. We certainly want moms to lean hard on their providers, but they need to know to contact their provider. I speak with so many moms that because they weren't educated on movement, even though they noticed a difference in movement, they didn't know what to do with that information, or they were reluctant to speak up. They didn't want to be considered, just a panicked mom, and so they did not speak up as quickly, and they live with a lot of guilt and regret from that. And it has nothing to do with them. It has to do with the lack of education, how to track movement, why it's important, and what to do with information. And so we want to make sure not to educate them to falsely get their babies to give basically a false reading on movement. Babies kick less near the end of pregnancy. That's actually not true. I addressed that a little bit earlier. Babies are living beings who move up to and during labor, even during labor. And so it's important that moms be in tune with that. So that is a myth. Babies don't run out of room. They don't slow down. Those are very dangerous myths, and we need to debunk those. This we already addressed. I apologize. That's a replication. Triage doesn't need any count the kicks education. So if you are working in labor and delivery triage, you actually are seeing moms that have concerns. And so actually you do need this information, because some of those moms are going to go home. They're not going to go in the hospital to be monitored. There's nothing that really is found, but sending them home with education about movement, paying attention to that actually is extremely helpful in reducing their anxiety level, so that they know when to speak up. They have the data. It's like a data download of mom's intuition is what we say about the app, but also that they will know when to come back, because the last thing we want to do is discourage women from speaking up and have a baby's life lost because of that. Other ways to integrate, this could be a whole systems change. And I think I'm really passionate about that. What is on your discharge paperwork if you're working in labor and delivery triage? Is that up to date? Does it have information that's relevant? Does your whole staff know what to do if a mom calls in with concern? Everyone needs to be educated on what to do. And if your client, if you're working with at home health visiting, if they're expressing concern, what do you do with that information? So the entire staff needs to know what to do with that information. Can you include it on a family care intake form? Can you participate in educating during glucose testing? Is that just put into the system as a part of the process? Could it be a part of your medical records or your Epic technologies that are just things that you can do? Here's an example of discharge paperwork that's being used by a hospital here in Iowa, Mary Greeley Hospital, where they literally have put Count the Kicks into their discharge paperwork so that moms have the information. So you can talk about it, but also having a place they can go back to the information and to make sure that they have what they need, as an example of a systems change. We have these clinic forms that we're trialing, and we'd be glad to get you some of these if you work in a clinical setting to trial in your office as well. Essentially, a way to have the conversation every time a mom comes in the third trimester, where either the front office staff and or the nurse hand them this little piece of paper where they answer questions about movement that can be given to the provider, or the nurse could go through that. It's just having the conversation in an educated and informed way and listening to what the feedback mom's giving them. There is a perforated line where mom can tear off information. Notice she has written down the doctor's office phone number. Moms need to not only hear that they have permission to speak up and that you will listen. They need to know how to do that, like who to call, how long to wait, should they go straight to labor and delivery triage. We don't want mom caught in a system of waiting for 3 or 4 hours for a call back when those are the hours and minutes that could be mattering to her health or her baby's health. And so making sure they not only know what to do, but how to do it is important. We've had other partnerships like Celebrate One in Columbus, Ohio. They see about 2,000 Black women a year, and they only see them once. They have one touch point. And so this is an example of how they implemented Count the Kicks in their intake form, so that they had that one touch point, that one opportunity to inform and educate women. And so that's just an example of another systems change, just thinking about what the work that you're doing and how you can perhaps include it in the work that the systems that you use from start to finish when I'm working with expectant parents. Childbirth educator, just so you know, if you do work with childbirth education, there are free lesson plans, sample lesson plans on our website and available for your use. It's another way to educate, right? That's an opportunity to educate on lots of things in pregnancy. We would love to have you include Count the Kicks as a part of that prenatal education that's being provided. So let's talk about Florida and some additional resources. And I just love this slide because little baby Eva is a baby save out of actually the state of Kansas, and just a little doll and adorable and a great, powerful story. So what resources do we have in Florida that are already there? This is free of charge, thanks to the state of Florida, the Florida Department of Health's partnership with us. And so the app is free for moms to download anywhere. We have over 160,000 app downloads in 140 plus nations across the world and across all 50 states in this country. And so that tool is free. We've talked a lot about the app. So let's move on to our educational materials. Also free to you is all the educational materials that you see here, posters, brochures, app card reminders. They're like little business size cards that you can hand a mom and say, here, take this, download this app. It'd be a really great way to bond with your baby and get to know their normal. So you might notice a change and you need to let your doctor know that. The brochures talk through, like, how do you count your kicks? Why do you count your kicks? We also have low literacy posters and brochures. And specifically, we have these materials in 3 languages, English, Spanish, and Haitian Creole. And so it hopefully is reaching a large audience in the state of Florida. These are free materials, free. Go to our website, www.counttthekicks.org. Go to the state of Florida, click and order away. It has no cost to you except for a few minutes of your time. I would love nothing more than to see orders flow in after this presentation. And so I encourage you to not only order these materials, but to download that app and learn what it has to offer so that you have it on your phone and you can show it to your patients and clients. Have a real quick educational session. Just 3 to 5 minutes on this at the beginning of pregnancy, and then those follow-up touch points throughout pregnancy and the conversation really can save lives. Another exciting thing in Florida, you're going to start seeing in various areas across the state, billboards. And here are some examples of both English and Spanish billboards that are going up across the great state of Florida. We're super excited about this. It's obviously a campaign meant to reach women that are expecting. And so hopefully we see even more app downloads come from constituents in the state of Florida. Kick counting magnets to hand out to expectant parents that they can put on their fridge as a reminder. Those are available when you check out. When you go to the www.countthe.kicks.org, you can actually check out and then it will give you a pop-up that says, you can get 50 magnets. Do you want to do that? And you can order those magnets and have them shipped. Again, completely free, thanks to the partnership with the Florida Department of Health. And we are just super excited about that. Count the Kicks, Stir Up the Conversation campaign. We sent 102 or 103 mailers in the last month to specific providers across the state of Florida to put stirrup covers on tables to stir up the conversation about kick counting as a visual. And so that was a super exciting campaign. We do have just a handful of these left, just a handful. It would be first come, first serve. But if you wanted to contact me and get a set or so, I do have a few available to send out. So please let me know after this presentation if you'd like some of the stirrup covers. Finally, the state of Florida is also providing this short PSA that I'm going to play for you, our public service announcement. So let's listen to it. Or maybe not, doesn't seem to want to play. I will include a link to that in the email following up. So apologies that it's not working for me right now, but I will include a link so that you can watch this PSA in the email that follows this presentation with all the items you need to get your CME credits and to have the PowerPoint slides, and also we'll get this recording to you. So another resource in the many states, including the state of Florida, is a Count the Kicks ambassador. And who are these? They're volunteers that they're passionate advocates due to their own personal experiences. We currently have 45 women across 29 states, the District of Columbia, and one ambassador in Canada. And many of them come to us, 35 of them come to us out of loss. If they lost a baby, they believe that knowing this information, Count the Kicks information, education could have made a difference in their story. And so they're passionate about that. 5 of these women come to us because they saved their babies with kick counting and with Count the Kicks. And so they're passionate about the impact in their lives and want to make sure other women have that and get their babies home safely. Ambassadors can do so many things. Like I said, they're that like boots on the ground, grassroots person. And so ambassadors do a variety of events such as medical conferences, baby fairs, give media interviews, work to grow partnerships, some fundraise, they give presentations. They could co-present with me on a webinar like this. They advocate for legislation and more. And so in the state of Florida, we have one of those baby save moms, Sarah Seriani, who originally was from Iowa, had moved to Florida, knew about Count the Kicks, and was able to save her son, Ryan. And she says, after weeks of counting and getting to know our baby's movements, I noticed a change and quickly told my doctor. After failing tests, we were advised to deliver. Our son, Ryan Joseph, was born with a true knot in his umbilical cord, but thankful to the quick response, he was otherwise healthy. I'm eternally grateful to this campaign for bringing awareness to me and so many other expectant women. So here are some more of our amazing baby save faces. I've interacted with Nala's mom just in the last week. They remain powerful advocates for us and a part of our campaign. You see Luna and Everett and baby Eva, and we have baby Deo in Florida, who is a baby save directly tied to Florida's A1's Nancy Travis, who we consider a great advocate for Count the Kicks and a personal rock star. And so these are examples of babies that we have the stories for. We know there are so many more babies out there. We know that if we could reduce the stillbirth rate by 32%, like we've seen in Iowa in the first 10 years of the campaign, if we could see that and save 1 in 3 at-risk babies in every state across this nation, and that would be 7,500 babies a year that would come home to their families. 7,500 families that would not suffer loss. And that is our goal. And that's what we believe we can do. But we can only do that with your partnership. Just due to time, we're going to go ahead. I'll include Nala's video, but we'll go ahead and skip past it. But this is a baby safe story out of Iowa. Next steps. Familiarize yourself with the Count the Kicks app. Practice, practice, practice. So if you have not during this presentation picked up your phone to download that app, that's probably one of the rare exceptions to the rule. Will be do it. We strongly encourage you, even right now in this moment, to pick up your phone and go to either Google or the Apple Play Store and download that app. Learn the app. It's super easy. I've never carried a baby while this app existed, but I do use it and test it and share it. It's easy, it's simple, it's education-based, and it is not fear-based. And so we would love to see app downloads in Florida increase, getting that tool into moms' hands. Order your materials. I would love to hear from my operations specialist, Amanda Allen. Jen, there are so many materials orders coming in from Florida. That is an action you can take. You can get it to all your clients. You can get it to all your offices. Hang those posters in waiting rooms and clinic rooms and bathrooms, public bulletin boards. Where do pregnant women intersect with not only your work, but with your community? Where can you put those materials so that expectant women have this important education? Take that important 3 to 5 minutes to educate your patients, your clients. However you intersect with them, you have the power to share this information, and it could save their baby's life. It also could impact their own health. If there's a problem with their health, we know sometimes that baby's movement changing can be life-saving to mom and to baby. Make sure your entire staff knows about that campaign. Think systems. What can we implement? How can we implement this systems wide so that everyone is in tune and informed about how to make these changes? Use those electronic health records to your advantage. Remember, hours and minutes matter in preventing stillbirth. We would rather a woman get checked out and find out that all is well than to not speak up or not have this education and find out after her baby's gone that movement change was a sign of distress. And remember, when we say movement change, we're talking about strength and duration. The third type of movement change that's important to note is a wild surge of movement. Some women experience this. It's usually a very big sign of distress in a baby, and they certainly need to act on it immediately. Straight to a hospital would be our advice. Of course, we always advise that you provide this education, and we encourage women to speak up to their provider. Their provider is their professional. Their provider is the one that's going to assess the situation, order the tests, evaluate, make decisions. That is why it's important for the women to go to their healthcare team with their concerns, and we let the professionals take it from there. And so it's important that they know that they need to seek that help. So finally, I just want to thank you for participating in this webinar. I want to thank you for being advocate in your state, for sharing this education and giving me your important time. I am here to answer any questions that you may have at this time. Please note that my email is on this slide. It will be shared with you as well. I am here, our Director of Programs, Megan Ockett, is here to answer any questions, provide any support. We would love to help you and your team implement this across the state. We are super grateful for the opportunity to host this CME training webinar in partnership with the Florida State Department of Health. We thank especially Casey Omecki, who is our contact there and is a fabulous partner and doing great work with us. And so if you have any questions, please put those in the chat. I'm glad to answer those at this time. And I'm glad to have fit that into an hour. I hope you found it educational, informative, that it got the wheels turning on how you can interact with your clients and patients. and change the systems that you have in place. Any questions for me? Would love to answer them if so. Thank you. Thank you for joining. The sun is coming out in Iowa. I hope you have a sunny day in Florida as well. We're just very excited to see the change that you're going to make in your state and get more of those babies that you're seeing on the screen here safely. Thanks, Carolyn. I appreciate the compliment. All right. It is exactly 12 o'clock. We hit our hour. If you have a question, please share it. Oh, absolutely. Please share any questions or concerns. Thanks, Casey, for that. Thanks for sharing your email. We deeply appreciate your partnership. I'll make sure to include that email in the follow-up to this presentation as well, Casey, so that it's easily accessible for everyone. All right.